My name is Star, and I'm going to be doing my teaching project on breastfeeding. I decided to choose this topic because I breastfed my daughter for 18 months, and she's now 2. Some interesting facts about breastfeeding and breast milk are that breast milk will actually change its nutritional needs to meet the baby's nutritional needs as the baby grows. Breast milk also provides protection to the baby as it aids in reducing the risk of long and short-term illnesses like asthma, obesity, type 1 diabetes, and SIDS. Breast milk also has antibodies from the mom in it, so it helps boost the baby's immune system because, as we know, babies are born with a very low immune system and they're not able to fight infections off. And some benefits regarding the mom with breastfeeding is that the mom's risk for developing type 2 diabetes, ovarian cancer, breast cancer, and hypertension are decreased. Now, those that are interested in breastfeeding, it is recommended that you breastfeed exclusively for 6 months before introducing solids, and that goes the same with formula-fed babies as well. Now, with breastfeeding moms, there are some risks and some complications that can occur, and these would include things like mastitis, clogged ducts, engorgement, and then a low milk supply as well. So mastitis is inflammation of the breast tissue, and that is very uncomfortable for the mom as it makes the breast very hard. Some other signs and symptoms besides the hard and discomfort breast would be red, like a red streak up the breast, and then flu-like symptoms like coughing, fevers, chills, and like nausea. For those that do suspect that they might have mastitis, it is recommended not to soak your breast into any kind of like a soapy bath or like bath water or applying heat, as those can increase the inflammation and make the pain worse. Mastitis is most common within the first 3 months of breastfeeding, and the best way to prevent mastitis or reduce the risk of getting mastitis is to make sure that your breasts are fully emptied in between feeds. So an example of this is if you have your baby and your baby is feeding off of the left breast and the baby has emptied the left breast, you would want to put the baby onto the right breast. And if the baby is unable to fully empty the right breast, you would want to pump after to reduce that risk of developing mastitis. Another complication that we had talked about was clogged ducts. So one breast has about 15 to 20 ducts, and if one of those get clogged, it is very uncomfortable for the mom. Some signs and symptoms of a clogged duct include the breast. You'll have breast discomfort during letdown, which is the initial flow of the milk going into the glands. You will also be able to feel some relief after the baby is done feeding, or if you are done pumping, you will feel some relief. Another sign is something called a milk bleb or a milk blister. And what this is it's a debris of milk around the nipple. And if you do develop one of these, you do not want to pop it because it can cause infection. Some common causes for a clogged duct would be the baby is having issues latching, so your breasts are not getting fully emptied. You're missing pumping sessions or feeding sessions. And all of this can lead to what's called engorgement, which is enlargement of the breast, which is also very uncomfortable for mom. And some common symptoms of engorgement would just be like large, bulky, hard breast, and very, very sensitive to touch. If the baby is having a hard time latching, this could be a sign of what is called a tongue tie, which we will get more into detail here in a little bit. Now we're going to go into feedings and like signs and symptoms, not so much symptoms, but signs to look out for and cues of that your baby might be hungry. So babies, especially newborns, they eat every 2 to 3 hours, and there is something called the rooting reflex, which is when you would lightly stroke the side of the baby's cheek, and the baby would turn its head and they would start sucking on their hands, they're smacking their lips, showing signs that they're looking for the nipple to latch onto. There's also a very distinctive cry when a baby is hungry that is referred to as the hunger cry, and this is when it's a very long, low-pitched cry that is broken up into long pauses that are in between. So we're going to start talking about the tongue tie, and what a tongue tie is, it is a band of tissue that is under the tongue that is attached to the bottom of the mouth. This causes the range of motion of the tongue to be decreased, which makes it really difficult for the baby to latch onto. If this is caught, there is a procedure that can be done to snip the band, and that will help increase the baby's feedings. Typically, after a tongue tie is discovered, it is recommended to see a lactation consultant just to make sure that the baby is being fed and that they are gaining weight properly like they're supposed to. Some indications of a tongue tie can be painful breastfeeding. Breastfeeding is supposed to be very painless. You're not supposed to have any pain. And then it's also supposed to feel more like a little pinch, but not like the baby is going to bite your breast off. Some common equipment that you will be using during your breastfeeding journey, it may vary person to person. Most of it is preference, but some of the basic needs that you will need would include a pump like this, which you will attach to a machine, or you can have a hands-free pump like this. And you would want to, after you pump, you want to be able to store your breast milk, so you can put it into a container like this if you would want to store it like in the fridge, or if you're going to use it right away for the baby. But if you have more of a long-term use and you want to store it, whether it's in the fridge or in the freezer, you can use a baggie like this. And those are like the basic needs. Everything else is pretty much preference. But when it does come to storing your breast milk, you do want to make sure that you store your breast milk properly. So breast milk can lay out on the counter in a lukewarm area or room temperature for 4 hours. And then if you want to store it into the fridge, it is recommended to store it for 4 days. And then if you want to freeze it, it is recommended to freeze for 6 to 12 months, and you want to use the oldest breast milk first. And then when it comes to thawing out your breast milk, you never want to microwave it. You will always want to either put it in the fridge overnight if you're going to use it the following day, or you will want to put it into like a glass and you can let it warm with some lukewarm water, like in a cup or on the counter, and just rinse it pretty much underneath of water. So those are the basic takeaways from this video, is that you will want to look out and keep an eye out for complications and try to do the measures to prevent any of the complications from happening. And then another big takeaway is you want to make sure that you are storing your breast milk properly and cleaning your pump parts properly as well. If your pump parts are not cleaned properly, it can cause the baby to get really sick. And that's the end of this video.